It's now my pleasure to introduce Tyler Lane, Senior Research Fellow working on the Hazelwood Health Study.
Thanks very much, Michael. Bit of background on Hazelinks. There are two main arms of that. The first is a health record linkage. This takes the survey I was just speaking about and links that to hospital records, ambulance records, and the Victorian Cancer Registry to try to make broader inferences using public health data. Um, and this is able to use some of the sociological data that's collected in the surveys, along with more precise estimates of smoke exposure, because we can place people during the mine fire roughly and combine that with modeled estimates of air pollution from the mine fire. The other arm of Hazelinks is using anonymous data extracts. So this doesn't have that sociological data or the precise smoke exposure indicators, but we can see where people were living and make broad inferences about their exposure. So if they lived in Morwell, they probably had more exposure to mine fire. If they lived in the rest of the Latrobe Valley, still some exposure, but lower, etc. We only have one study that's been published to speak about today, and that's looking at emergency presentations as they relate to smoke exposure. So this is from the linkage study, taking people who were part of that survey and combining it with Victorian emergency minimum data set. And for this, we had 2,025 people, and we were looking in the first 5 years post mine fire. So we were comparing people in Morwell, who again had the most exposure, to those in Sale, who had very little or minimal exposure. And what we see is an increase in respiratory conditions in that 5 year period, but not much else really emerged. However, when we broke that 5 year follow-up period into two chunks of 2.5 year periods, we see that cardiovascular disease uh, emergency department presentations increase, and then they subsided in the next 2.5 years. And this comports with a number of other of our Hazelwood Health studies, finding that the effects of smoke exposure on cardiovascular problems was really immediate and short term. So there was unfortunately an increase in cardiovascular related deaths shortly after and during the fire, more than we would have expected anyway, and not much else has been observed afterwards. So with the subsiding, it might be that there was some what we might call a harvesting effect. Those who were most vulnerable unfortunately faced the most consequences in the immediate aftermath, and that meant those who had exposure were less vulnerable on the whole than those who had less exposure, if you will. And we do have a number of studies in the pipeline. The first is looking at whether smoke exposure was associated with the development of new cancers. That is nearly complete. The results are quite preliminary, but it's really not showing much. This might be because we just haven't had enough follow-up period to make any strong inferences or detect any effect if there is one. Same thing with survival among those who already had cancers. The analysis is pretty well complete. And it's showing, again, not really much. I don't think we'll need much more follow-up to make any more inferences about that, though. I think that question may be well answered by that study. We also have a study looking at long-term hospital emergency and ambulance use. That's nearly finished. It's quite complicated, so I can't really give any preliminary summaries of what we're seeing so far. And then a study that's in the planning stages is looking at major adverse cardiovascular events. This is heart attacks, strokes, cardiovascular related deaths in the aftermath. So we might see that the most extreme outcomes may still be affected by the smoke exposure. But again, this one is still in the planning stages. Thanks very much.